Hello everyone, this is Dr. Jawad. If you're new to my channel, thank you for watching and welcome. If you haven't already, hit the subscription button down below, and right next to it is the bell notification. What that means is that when I try my best to upload videos weekly, and when I do, you'll get an email in your mailbox letting you know that I upload a new video. So being a functional medicine doctor, I get a lot of my patients who are on a lot of medication, heart medication, statin medications, so forth and so on, and they have all these symptoms. And when they come in with all these symptoms of muscle weakness, fatigue, so forth and so on, I always want to ask them, what are you taking for heart medication? And this is what I'm doing the video on. So enjoy the video. Thanks for watching. Hello everyone, this is Dr. Jawad. In this video, I'm going to answer a question that's asked a lot, and I'm on blood pressure medication. Actually, I'm on 4 different blood pressure medications. How come I keep on having these side effects? Well, the reason why you're on it, the goal of blood pressure medication is to lower your risk of heart disease. So that's first and foremost why you're on it. The side effect of how it works is that it blocks the essential vitamins and minerals from actually entering the cell. And this is a gradual process, meaning it'll occur maybe like 6 to 12 months. But by then the medication is not working, so what happens? You increase your blood pressure increases. And the doctor, you go to your doctor and they put you on either different medications, or they're going to put you on another medication. And this is why you're on 3 or 4 different heart medications, because you're getting a nutrient deficiency. Now, vitamin B1, thiamine, very, very important. We have cells called mitochondria, and that produces our energy currency in the form of ATP. Okay, so when you have a deficiency in vitamin B1, you have a condition called beriberi. Now, it's involved in the ATP production, but also too muscle contraction and also nerve conduction, basically how the nervous system works. So what happens when you get deficient, it makes the heart muscle have to beat harder. Okay, it makes it weaker, so it has to beat harder to pump the blood through the system, and this will lead to a condition called congestive heart failure. Now, I had a patient of mine who had this condition, and the blood pressure kept on getting higher and higher and higher, and they didn't know what was going on. So when I recommended going on vitamin B1, just 100 to 200 milligrams first thing in the morning, what happened? Because they were deficient, it lowered the blood pressure. Next is magnesium. Magnesium is involved in over 300 enzymatic reactions throughout the whole body. So magnesium is very important to how the body works. Okay? But another thing is that magnesium is a natural blood thinner. And also too, it helps control the heart rhythm. So when you have a deficiency in magnesium, it makes the blood thicker. So again, if you make the blood thicker, this increases the heart rate. So there are 9 different types of magnesium. One I recommend is magnesium taurinate. That's good for the heart muscle. Now you want to start off low and then eventually build up, because again, if you have too much magnesium, you will have loose stool or diarrhea. So I always recommend you want to take up to 500 milligrams of magnesium taurinate. Okay, you want to gradually work up to that. The next one is potassium. Potassium, we need 4,700 milligrams of potassium per day. And what it does, again, it helps with fluid balance. Okay? Nerve conduction, muscle contraction, and what happens, it also increases the blood vessel elasticity, so when it dilates and contracts. So again, when you have a deficiency in potassium, what's going to happen? You're going to increase the blood pressure. And what I recommend of doing daily is having avocados, bananas, sweet potatoes. Those foods in particular are loaded with potassium. And what happens is that we have sodium and potassium that work together, and we need 1,500 milligrams of sodium per day and 3 times the amount of potassium per day. So oftentimes we're taking in too much sodium, which again makes the blood thicker. Next is calcium. Calcium, again, it's involved with heart muscle function, nerve conduction, and again, when you're depleted in these, which again, these 3 are electrolytes. Electrolytes are very important for how the cells work in the body. And again, when you're deficient in these electrolytes, what's going to happen? You're going to increase the blood pressure, and also too, the electrolytes have a big influence on how the muscles contract. So calcium, if you're going to take a calcium supplementation, I always recommend calcium citrate. Or first and foremost, work with the diet. Okay, so again, fish, sardines, loaded in calcium. Green leafy vegetables, spinach, loaded in calcium. So again, these three electrolytes are very important in how the body works as a whole. And also too, these three are they're the most common nutrition deficiency when you're taking high blood pressure medication. So the last one, CoQ10. CoQ10 is phenomenal on how the body actually produces the energy system, okay? It generates the ATP in cells. So when you're deficient in CoQ10 due to high blood pressure medications, this is where you're going to skyrocket the blood pressure. You may get congestive heart failure, okay? Muscle weakness because CoQ10, coenzyme CoA, is actually important in how the muscles generate energy for contraction. So again, it's high in the fish and meats, and I always recommend minimal, taking 400 milligrams of coenzyme CoQ10 a day. It's a little costly, but it's definitely beneficial to the body. Okay, so again, high blood pressure medication, you get deficient in these essential vitamins and minerals. So this could be why your blood pressure medication is not working. Hope you enjoyed the video. I'll see you the next time. Be good. Hello everyone, this is Dr. Jawad. Hey, over the last couple of years, my YouTube channel has grown tremendously, and I can only appreciate it, the viewers who subscribe. Now, if you're watching this on YouTube, please hit the subscribe button to get the first up-to-date videos, or you could always Google my name, Dr. Jawad, and you could go to my JDoc Real Minute page. Again, if you hit the subscribe button, you'll get the most up-to-date videos. And thanks everybody who's watching. I greatly appreciate it. Thank you.